Hi, so we are going to talk about LSD breathing for coronavirus. LSD, we want long, slow, and deep breaths to help prevent the contraction of coronavirus and help to mitigate the load of coronavirus if we are currently infected or we feel like we may be infected. How? Through long, slow, and deep nasal breaths. We want to breathe through our nose. Our nose is for breathing, our mouth is for eating and sharing our opinion. So, why do we want to breathe through our nose with these long, slow, deep breaths? Because of nitric oxide. NO. Nitric oxide is produced in the nasal cavity, and nitric oxide, I feel, is like the golden ticket when it comes to upper respiratory infections and our breathing mechanics. So nitric oxide, when it is brought down into our lungs, it's a vasodilator, right? So it's going to redistribute the blood throughout our entire lung area. It's also going to help increase the production of surfactant in the lungs, which is in charge of the elasticity and mobility of our lungs. And when we have a chest infection or coronavirus and the symptoms are hard to breathe, we want as much elasticity and movement in that area as possible. Nitric oxide also stimulates the vagus nerve. The vagus nerve tells the brain, calm down, we are okay. So then the body can heal. It's very hard to heal our body in a stressful response because when we are in a stress state, we're going to constrict our breathing. We're going to breathe from our chest. We're going to breathe from our mouth, and the body's not going to be able to fight off anything. So nitric oxide is a great way to help fight off any viral or microbial infections going on. And nitric oxide is also going to be a key factor in redistributing oxygen into the tissues, right? It's going to allow the oxygen that we're breathing in to actually get to where it needs to go through the carbon dioxide, really. Carbon dioxide is always, so we want to get rid of it, I'll get rid of it. But carbon dioxide inside of our lungs is actually what tells the body, hey, release the oxygen from that hemoglobin into the tissues because we have a lot of carbon dioxide. So they kind of work in a balanced mechanism of that sort. When we have high carbon dioxide, the body says we need more oxygen, so then the oxygen releases from the hemoglobin into the tissues where it needs to go, and then it's actually functional oxygen that we can use. So how do we breathe these LSD magical breaths so that we can help prevent coronavirus in ourselves and help deal with the symptoms and the effects of coronavirus if we are currently infected? Take your hands and place them on your lower sides of your ribs. And again, we're going to be breathing through our nose. So I want you to take a 6-count inhale and then a 6-count exhale, and then just a little hold at the end. Nothing crazy, we'll do a 3-count hold. So inhaling through your nose, but remember, it's long, it's slow, and it's deep. It's not strenuous, it's not a because that is a really stressful response. We want it to just be nice and even, not too taxing. Let's give it a try. Inhaling for 6, 5, 4, 3, 2, 1, and exhaling it out through the nose. 4, 3, 2, 1. And just hold. 2, 3. Good, let's try that again. Inhaling for 6, 5, 4, 3, 2, 1, and exhaling 6, 5, 4, 3, 2, 1, and just hold empty. 2, 3. Again, inhaling, feeling the lower ribs expand into your hands, especially the sides and the back. 2, 1, open up that rib cage, and exhaling. 4, 3, 2, 1, and hold it. 2, 3. And let the arms go. And breathe normally through your nose. And remember that feeling of the lower ribs expanding through the back and the sides, and then exhaling it back down. And when that can become your normal breathing pattern, especially when you're sleeping, you're going to further enable your immune system to help fight off any sort of coronavirus or infection that you may have going on in the upper chest area. We breathe 26,000 times a day. You have 26,000 chances to improve your immune system and fight off any sort of virus. And if you do already have coronavirus, when you breathe through your mouth, you're eliminating 42% more water particles than if you were to breathe through your nose. So if you're like, I'm not sure if I have it, I don't really know, just do yourself and everybody around you the favor and breathe through your nose. That way you're not releasing as many water particles into the air, just in case if an airborne particle of virus decides to fly out of you, your better chances of not infecting other people by just breathing through your nose. So try some LSD breathing and let me know how it goes. You can do it I would recommend doing it for like 10 minutes, at least 2 or 3 times a day, especially if you are infected with the coronavirus. And if that becomes too much, do it at your pace and slowly build yourself up and watch your ability to breathe slow and deep breaths become more efficient and more of your autonomic processing and everyday breathing patterns.